Hello everyone, today we begins with the bleeding disorders. Anticoagulants, there are two types of anticoagulants, endogenous and exogenous. Endogenous anticoagulants includes heparin, antithrombin 3 and protein C, whereas the exogenous anticoagulant includes heparin, calcium sequesters, which are the decalcifying agents. These are the sodium citrate, sodium oxalate, and vitamin K antagonists, which are the coumarin derivatives, dicomarol, warfarin, phenindione. So anticoagulants are of two types, endogenous and exogenous. Classification of bleeding disorders. Here we are going to classify bleeding disorders in three types. First one due to the platelet disorders, second one due to the coagulation disorders, and third one due to the vascular disorders. So first of all, platelet disorders, which includes idiopathic thrombocytopenic purpura, and second one is the secondary thrombocytopenic purpura. Now the coagulation disorders, first one deficiency of clotting factors, second vitamin K deficiency, third one anticoagulant overdose, and fourth one disseminated intravascular clotting. So these all are the coagulation disorders. Now the vascular disorders. Vascular disorders includes due to the infection, toxic effect of drugs and chemicals, and avitaminosis C, allergic purpura, and connective tissue disease. So the classification of bleeding disorders, we are broadly classifying the bleeding disorders in three major types. First one due to the platelet disorder, second one coagulation disorder, and third one is the vascular disorders. All right. So first of all, platelet disorders. Idiopathic thrombocytopenic purpura. I hope everyone remember the word thrombocytopenia. So what is thrombocytopenia? There is a decrease in the platelet count. So this is the immune thrombocytopenia. The causes are increased the platelet destruction and impaired platelet production. So whenever there is a destruction of the platelets becomes increased or production of the platelets become impaired, there will be the condition of thrombocytopenia, means decrease in the platelet count. And so this condition is known as idiopathic thrombocytopenic purpura. And whenever simultaneously with the thrombocytopenia it also causes the bleeding disorders, then the condition is known as idiopathic thrombocytopenic purpura. Secondary thrombocytopenic purpura, which occurs due to the bone marrow depression, leukemia, and secondary deposits of malignancy in the bone marrow, acute septicemia, and hypersplenism. So all these are the causes of secondary thrombocytopenic purpura. Relation between platelet count and bleeding disorders. So first of all, remember the normal platelet count. The normal platelet count runs between the 1,50,000 up to the 4 lakhs platelets per cubic mm of the blood. So here we are going to see the relation between the platelet count with the bleeding. Whenever the platelet count is above 1 lakh, there will be no any type of clinical symptoms. Whenever the platelet count in between the 50,000 to 1 lakh, bleeding after major surgery is possible. Whenever the platelet count is between the 20,000 and 50,000, bleeding after minor trauma in everyday life. And whenever the platelet count is below 20,000, spontaneous hemorrhage in GIT, urinary tract, and nose. So that is the serious condition. And whenever the platelet count are very low, that means less than 20,000, there is the fatal hemorrhage in the brain. Functional disorders of the platelets. It may be drug induced due to the intake of aspirin or penicillin. It is due to the von Willebrand's disease, and other causes are uremia, cirrhosis, and leukemia. There is a mild possibility of this thrombocytopenic purpura. So here in the thrombocytopenic purpura, the word thrombocytopenic means there is a alteration in the functions of the platelets. Please remember. Now coagulation disorders. Deficiency of clotting factors. So hemophilia. Hemophilia A, hemophilia B and hemophilia C. Hemophilia A in 83% cases are present. Classical hemophilia due to the deficiency of factor 8. What is factor 8? It is anti-hemophilic factor. So broadly we are classify the hemophilia in hemophilia A, hemophilia B and hemophilia C. Major patients of the hemophilia are of hemophilia A type, 83% cases. Classical hemophilia, which is due to the deficiency of factor 8, which is anti-hemophilic factor. Second one is the hemophilia B, 15% of cases due to deficiency of factor 9. Factor 9 is the Christmas factor. So whenever there is a deficiency of this Christmas factor occurs, the condition is known as hemophilia B. And hemophilia C, which is in the 2% of cases due to deficiency of factor 11. Factor 11 means plasma thromboplastin antecedent. So whenever there is a deficiency of this factor number 11, which is plasma thromboplastin antecedent, there is the condition of hemophilia C. So hemophilia is a bleeding disorder which is due to the deficiency of clotting factors. Hemophilia A, inheritance of hemophilia, carrier mother and father without hemophilia. So here the father, which is without the hemophilia, and mother is a carrier of the hemophilia. Hemophilia is a X-linked disorder. In the female there are 2 X chromosomes are there. So even if the one X chromosome is defective, the another one is normal. So female are almost and always a carrier for this hemophilia disorder. But inside the males, where there is only single presence of X chromosome, so in this condition, whenever there is a defective X chromosomes are there inside the male, so there is a presence of hemophilia in male is obvious condition. So we are going to sing the childs of the parents, where the father is without hemophilia means the normal father, and the mother is carrier of the hemophilic gene. So here the one X chromosome is damaged. So the possibilities in their children, first one is the son, which is a normal. Second one is the daughter, which is a carrier. And whenever the son with a defective X chromosome, there is a presence of hemophilia. So son having the hemophilia, and the daughter which having the both normal X chromosome does not having any hemophilic disorders. Whenever the father is normal but the mother is carrier, the possibility of hemophilic children or hemophilic male is around 25%. Likewise, in the females, the possibility of carrier females is also around 25%. Clinical features: bleeding tendency become apparent in later life, bleed in soft tissue, muscles, joints, GIT, urinary tract and nose. Here the GIT is the gastrointestinal tract. Joints severely damaged, respiratory obstruction when hemorrhage around floor of mouth. So these all are the clinical features of the hemophilic condition. Relation between level of factor 8 and state of hemostasis. So here the factor 8 is the anti-hemophilic factor. And what is hemostasis? Whenever the anti-hemophilic level is more than 50%, the condition is normal. Whenever the anti-hemophilic factor is between the 25 to 50%, excessive bleeding after severe trauma are the possibilities. Whenever the anti-hemophilic level is between 5 to 25%, excessive bleeding after minor trauma is also occurs. And whenever the anti-hemophilic factor level is 1 to 5%, severe bleeding after minor trauma is the possibility. And whenever the anti-hemophilic level is less than 1%, there will be the spontaneous bleeding. So this is the relation between the level of anti-hemophilic factor and state of hemostasis. Treatment. We have to give the repeated small fresh blood which is collected within half an hour, fresh plasma and factor 8 concentrate. So the choice of treatment available, first one is the repeated small fresh blood collected within the half an hour. We have to infuse. Second choice is the fresh plasma. The third choice is the factor 8 concentrate. Factor 8 is the anti-hemophilic factor. Now the vascular disorders. The possibility of vascular disorders is a drug-induced deficiency of vitamin C, allergic purpura, infections, senile purpura and connective tissue disease. So these all are the causes of vascular disorders. Laboratory test in bleeding disorders. First one, bleeding time. Second one is the platelet count. Third one is the clotting time. Fourth one is the prothrombin time. Fifth one is the partial prothrombin time. Sixth one is the thrombin time. And seventh one is the clot retraction test. So bleeding time is the time taken from puncture of blood vessels to the stoppage of bleeding. And clotting time is the time taken from puncture of blood vessels till the formation of fibrin thread. So laboratory test in bleeding disorders, we have to do the bleeding time, platelet count, clotting time, prothrombin time, partial prothrombin time, thrombin time and clot retraction test.